My name is Dr. Martin and I'm going to explain the role of the NHS Ayrshire and Arran Pain Management Service. I am one of the doctors working in the service. Now, there are many chronic pain sufferers in Ayrshire and Arran. Pain is regarded as chronic if it lasts longer than 3 months, but many of the patients who are referred to our service have had pain for much longer. Pain sufferers can seek help from their own doctors. GPs can provide advice, prescribe painkillers and refer patients to specialist services. The pain-killing medicines work well for some patients, but unfortunately many patients do not find them helpful. They are not always effective and sometimes cause troublesome side effects. One of my colleagues talks about the medications in another video. Some people with chronic pain are able to carry on as normal, but pain can have many negative effects. Some patients become disabled by their pain and can be forced to change their role at work or reduce their hours. Some unfortunately need to give up work altogether. Pain can make it difficult to carry out domestic tasks, to take part in hobbies, and even just to get out and about. Sleeping can also be difficult. Chronic pain and disability can influence the outlook of pain sufferers. They can start to feel depressed, anxious, guilty, frustrated and angry. To give one example, in my experience, parents of young children find it particularly distressing when they are no longer able to care for them in the way that is expected. If they are unable to bath them, dress them and play with their children in the way that most patients take for granted. It can be difficult for patients to understand why they have developed chronic pain. So GPs usually refer patients to the pain service when the medications are not working and the sufferer has become disabled by their pain or is struggling emotionally with it. When the patient attends the appointment, they will undergo a thorough assessment of their pain and its effects. Unfortunately, we sometimes have to explain to patients that we cannot cure their pain. If that is the case, we do aim to reduce the disability and distress brought on by the pain so that by the end of their treatment, sufferers are less depressed, less frustrated and less anxious. We also hope that our patients have been able to get back to some of the activities affected by pain. Now, this treatment can involve appointments with specialist physiotherapists and clinical psychologists. These treatments are explained in other videos, but they are sometimes lumped together and called guided self-management, and for the best outcome they depend on the patient themselves being part of the therapeutic team. I sometimes explain this to patients by asking them to imagine that I am showing them a map with a route marked which they have to follow. Now, the staff will do their best to help and support the pain sufferer and keep them on the right path. But the sufferers themselves have to make that difficult but very worthwhile journey. In summary, the aim of the pain management team is to guide sufferers to a better quality of life. Thank you for watching.